Zolinza, generically known as Vorinostat, is used to treat cutaneous T-cell lymphoma. Vorinostat is a histone deacetylase inhibitor. Vorinostat has been approved as a therapeutic agent for patients who have at least 2 systemic therapies for cutaneous T-cell lymphoma, also known as CTCL. CTCL includes mycosis fungoides and Sézary syndrome.
Cutaneous T-cell lymphoma is a type of cancer of the immune system that arises from mutation in T cells. This cancer is also known as CTCL, and it's a form of non-Hodgkin's lymphoma, a group of cancers that impact white blood cells in the body. CTCL is characterized by uncontrolled T-cell growth, and then these cells accumulate in the skin. A lot of the primary symptoms are seen in the skin, and there are 2 types of this cancer. One is mycosis fungoides, which usually presents with rash, plaque, and tumors on the skin. Another is Sézary syndrome, which presents with red, scaly skin, thickening of the skin, especially on the soles of the feet and around the eyelids, and thinning hair. This cancer can become extremely dangerous if it metastasizes to lymph nodes or other organs, and Vorinostat is very helpful in treating this cancer.
Vorinostat binds to the active site of histone deacetylases. It therefore works as a chelator and is active at these sites. Vorinostat is able to inhibit the binding of histone deacetylases and will cause a large amount of transcription factors. Transcription factors are needed for induction of differentiation among the cells. Vorinostat also is able to reduce inflammation. This will in turn cause an increase of expression of the T regulatory cells.
Histones are inhibited when binding to the drug Vorinostat. Consequently, there is an accumulation of acetylated histones and acetylated proteins, including transcription factors that are needed for the expression of gene needed to induce cell differentiation. As a result, inflammation is reduced and there is an increased expression of T regulatory cells. When Vorinostat is proved to be successful, there are side effects that occur when overdosing. When dosage exceeds 400 milligrams, the body enters into a toxic state, rendering the clinical benefits of dose escalation very minimal. In agreement with FDA approval, most common side effects include fatigue, diarrhea, and nausea. Although prevalent, these side effects prove to be mild to moderate, not requiring any intervention. Thrombocytopenia, dehydration, pulmonary embolism, squamous cell carcinoma, and severe anemia are among side effects that require the attention of a doctor. All side effects considered, Vorinostat taken at the appropriate dosage has seen 31% of people evading life-threatening effects. This dosage requires 400 milligrams taken orally once a day.
With the approved dosage of Vorinostat of 400 milligrams per day, a response rate of 31% is seen with very few life-threatening adverse effects. Patients that received 300 milligrams twice daily produced an overall response rate of only 21% with adverse effects such as pulmonary embolism and thrombocytopenia. Chemotherapy is most effective at killing cells that are rapidly dividing since it is an attribute of cancer. Because chemotherapy does not know the difference between the cancerous cells and the normal cells, some normal cells will be killed with the use of this drug. These cells are likely to be some blood cells, mouth cells, stomach, and bowel cells. The hair follicles will also be killed because they reproduce rather quickly. This is why many chemotherapy users experience low blood counts, mouth sores, nausea, diarrhea, and/or hair loss.
With the FDA-approved dosing, the most common side effects include fatigue, diarrhea, and nausea. These side effects were usually mild to moderate, needing little to no intervention. Other side effects are life-threatening and required hospitalization, include thrombocytopenia, dehydration, pulmonary embolism, cell carcinoma, and severe anemia.